Welcome to the Ryan White Planning Council's first public hearing for 2020. In keeping with best practices for social distancing to slow the spread of COVID-19, the public hearing was pre-recorded online through Zoom. If you would like a copy of the information being presented this evening, you can view and download the documents from our website at rwpchouston.org. My name is Rodney Mills, and I am one of the co-chairs of the Affected Community Committee for the Ryan White Planning Council. Also with us this evening is my co-chair, Veronica Ardoin. The chair of the Ryan White Planning Council, Tanya Pradia, co-chair of the Quality Improvement Committee, Pete Rodriguez, and Tori Williams, liaison to County Judge Lena Hidalgo. The focus of tonight's public hearing is the recommended changes to services funded by Ryan White Part A, Part B, state services for fiscal year 2021, which will begin on March 1st, 2021. But first, there will be a presentation on COVID-19 and living with HIV by clinical consultant Pete Rodriguez. Afterwards, Pete will explain the Quality Improvements Committee, how to best meet the needs process. He will also present the committee's recommendations for Ryan White funded medical and support services provided in Harris County and the surrounding area. Remember that everything discussed here will not affect how services are delivered now, but will impact how services will be delivered in approximately 10 months from now in the year 2021. After the presentations, you will learn how you can give public comment regarding the information presented. At this time, I would like to turn the meeting over to the chair of the Ryan White Planning Council, Tanya Pradia, who will describe the role of the Planning Council and the purpose of this public hearing. Tanya.
Thank you, Rodney. Good evening, everyone, and welcome. I would like to briefly describe the history of the Planning Council, what it is that we do, and why we are here tonight. The Ryan White program is the largest federal program focused exclusively on HIV care for those who do not have sufficient health care coverage or financial resources for meeting the challenges of HIV disease. Ryan White fills the gaps in care that are not covered by other sources. The federal legislation is known as the Ryan White HIV/AIDS Treatment Extension Act of 2009. It was first enacted in 1990 as the Ryan White Care Act and has been amended and reauthorized 4 times in 1996, 2000, 2006, and 2009, adjusting with each reauthorization to accommodate new and emerging needs, such as an increased emphasis on providing life-saving and life-extending medical services for people living with HIV. The Ryan White program works with cities, states, and local community-based organizations to provide HIV-related services to more than 500,000 people each year. There are several parts within the Ryan White program, each one designed to meet the needs of different communities and populations affected by HIV. Part A funds are designed to serve metropolitan area and are awarded to the chief executive official, primarily responsible for providing health care in the geographic area. In the Houston-eligible metropolitan area, that person is County Judge Lena Hidalgo. In 2018, Harris County received approximately $23 million to provide services for people with HIV throughout the 6-county area, namely Harris, Fort Bend, Waller, Liberty, Chambers, and Montgomery counties. Part B funds are awarded directly to the state of Texas and are used to provide care for people with HIV in 10-county area, which includes the 6 counties named previously. and Austin, Colorado, Waller, and Walton counties. In 2007, the state asked the Houston-Ryan White Planning Council to make recommendations for Part B and state services. Funded since they are responsible for allocating Part A funds in fiscal year 2019. Ryan White Part A, Part B, and state service dollars totaled over $29 million. Again, Congress requires that most of those funds be used to provide medical services for people living with HIV in the 10-county area. Currently, approximately 14,000 individuals out of 29,000 people living with HIV in our area are using a Ryan White funded service. By law, the council is charged with determining the number of individuals in our area who are living with HIV, assessing the needs of HIV community, establishing a comprehensive service plan, setting service priorities, and allocating funds, assuring that there are sufficient services to meet the future needs of the changing epidemic, assuring that appropriate services are available to meet the needs of the underserved, women, infants, children, and youth, ensuring access to services for those who have substance abuse treatment needs, and assessing the administrative mechanism which procures services and disburses funds. The Planning Council falls under the Texas Open Meetings Act, and its processes are open to the public at all levels. We strongly encourage participation by all members of the community and take public comment and input very seriously. The council meets on the second Thursday of every month at noon at the Harris County Annex 83, located in the Galleria area at 2223 West Loop South, between Westheimer and San Felipe. For more information, the phone number is 832-927-7926, or you can visit us on the web at rwpchouston.org. The information will be repeated for you at the end of the program. It is important to remember that Ryan White funds are the funds of last resort. This means that all other resources for an individual must be exhausted or unavailable before Ryan White funds can be used. For example, a person must use their private insurance, Medicaid or Medicare benefits before they are eligible to have Ryan White monies paid for primary medical care. There are also income eligibility requirements that govern the use of Ryan White funds. Many of these services that we provide have an income cap of 300% of the federal poverty guidelines, which means that an individual with a yearly income of $38,280 or less would be eligible for assistance, provided all other avenues of coverage have been exhausted. The same guidelines apply to a single parent with one child would be $51,720 or less. The service categories to be reviewed this evening include those that are funded by Ryan White Part A, Part B, and state services. Examples of some of the services which the Ryan White program funds are allowed to provide include outpatient, primary, medical care, medication, dental care, mental health services, and assistance to pay for health insurance premiums, co-pays, and deductibles. The purpose of tonight's program is to inform the public of recommended changes to the local service category definition, in order to get feedback from consumers of the Ryan White funded services and others as to how the recommended changes will affect their ability to receive care and support services. Community input is not only necessary, it is vital to all the Planning Council's processes and is encouraged at every level. At this time, I would like to introduce our next speaker, Pete Rodriguez, clinical consultant for HRSA HIV/AIDS Bureau, who will present information about COVID-19 and living with HIV.
Great. Thank you so much, Dana, and thank you for joining us tonight. Tonight, I'm going to talk about HIV and COVID-19 and some things that, particularly to people who are living with HIV, should be concerned about. Next slide, please. What I'll be talking about tonight are the objectives are going to be what is COVID-19, what are the symptoms and treatments, and I'll be talking about transmission and prevention. Next slide, please. Next slide, please. What is COVID-19 and how is it passed on? COVID-19, coronaviruses are a family of viruses that cause illnesses such as the common cold, and in this case, COVID-19. The name coronavirus has to do with what the virus looks like under a microscope. Corona means crown, and all coronaviruses have a similar structure. They are called enveloped viruses, which means they're able to stick to surfaces, but are also able to be killed with disinfectants. The virus is called novel because it started with an animal population and was transmitted to a human, and now can go from human to human. And there have been some reported cases of humans passing it on to their pets, their dogs and cats. However, you can't get it from the dogs and the cats. Our immune system hasn't seen this particular strain of virus before, so none of us have developed immunity for it. At this time, there's not a vaccine, but the good news is there are about 95 clinical trials for a vaccine worldwide. It is more likely that this virus is more contagious than influenza or the common cold because it's so new to humans. We aren't used to it. We have a way to fight the other viruses that come along, like the common cold or the flu, but with this one, we just don't because we aren't used to it. Next slide, please. This results in the virus causing more damage to the cells and producing inflammatory cells, which can damage the body trying to fight off the infections. For people with decreased immunity because of medications or because of special conditions from aging, the result of the COVID-19 disease can be much more serious. Currently, there are about 141 million cases in the United States and about 83,000 deaths in the US. Worldwide, there are about 4 million deaths, 4 million cases and about 249,000 deaths. Here in Texas, this slide was from May the 5th. And you can see that at that time, there had been 427 tests. There had been 33,000 reported cases, and at that time, 906 fatalities. As of yesterday, May 15th, there were total tests done in Texas were 587,000. 42,000 cases have been reported, and there have been an estimated 1,158 fatalities. Next slide, please. Here in Harris County, the breakdown by race and ethnicity is for the Black population, it's about 15.6%. For Hispanics, 37.4%, and for white, 28.1%. Asian is 3.9%. It's pretty evenly split between males and females. And again, this data that I did was from May the 5th. Harris County has a population of over 4 million people. And on the 5th, we had 1,000 cases here in Harris County and the city of Houston. To date, as of May 14th, we have 13,000 cases, and we have about 334 deaths. Next slide, please. This shows that of another thing that you can see is New York City. New York City has 171,000 cases and 43,000 people just in that city have been hospitalized. What are the common symptoms of COVID-19? The common symptoms, of course, dry and a continuous cough, fever when you're back or you're just hurting all over, feeling tired, and other flu-like symptoms. Some of the new symptoms that are being seen too are a loss of taste or a loss of smell. And some people have had diarrhea and GI upset. And the thing that's most concerning to us is a lot of people are actually infected with the virus and have absolutely no symptoms. And the problem with that is they may not have any symptoms whatsoever, and they're around people and they're able to spread that virus even though they aren't showing any symptoms. Just recently, in the past week, we thought that children were safe from this disease, and we were proven wrong. As of yesterday, the 13th of May, over 100 children have been infected with the COVID-19, and they're showing symptoms of something similar to Kawasaki disease. And Kawasaki disease is a syndrome that affects the different parts of the child's body. They'll show signs of a rash, conjunctivitis, which are the red eyes, swollen hands, red cracked lips, and unfortunately, this can lead on to aneurysm, enlargements of the heart, and enlargement of the coronary arteries. And unfortunately, we've had some deaths in children from COVID-19 from this particular virus. Next slide, please. So how do you prevent COVID-19? How can you prevent it? Well, of course, the first thing that you can prevent, of course, is to wash your hands. You've probably heard that a million times, but it's really, really important. And it doesn't have to be with a disinfectant. It can be just plain old-fashioned soap and water. The thing is to wash it for at least 20 seconds and wash the back of your hands and the front of your hands. This is the really hard part, for me especially, is to avoid touching your face, especially your eyes, your nose, and your mouth, because they found that the coronavirus can enter your system through those areas, through the nose and through the mouth. That's why it's really important if you're around somebody who's sneezing and coughing that you avoid them, especially, and the recommendations are to try to stay at least 6 feet away from somebody. If you have to cough or sneeze, it's always best to sneeze into a tissue, then throw away the tissue and wash your hands. If you don't have tissue, use the inside of your elbow to cover your mouth. And of course, stay at home is the best way to try to avoid this virus. Next slide, please. Now, what do you do if you have symptoms of the virus? Well, what you can do is, number one, stay at home and call your local health service to see about testing. And at the end of this presentation, there are going to be some contact numbers and some contact websites for the city of Houston and for Harris County. If you are ill, ask your friends or neighbors to leave supplies outside the house. Again, avoid close contact with anybody else. Stay at least a foot away. If you live with other people and you have been diagnosed with the coronavirus, it's best to avoid any contact with them. Don't share plates and cups. Don't share the bathroom with them. If possible, stay away completely from other people, especially if you've been diagnosed with COVID-19 and you're living with somebody who is elderly, who has a immune deficiency. It's best to stay away from those people. Most symptoms can be managed just with resting, drinking liquids, and Tylenol, not ibuprofen, Tylenol. And if your symptoms don't improve, next slide please, after 7 days, or you have difficulty breathing especially, you need to call your physician immediately. Don't just show up at the hospital or the clinic, call them first because they may tell you to go straight to the emergency room. Now, if you're living with HIV, there are a couple of things that are particularly important. Again, follow general precautions to make sure that you don't, if you've been exposed to the virus, wash your hands well wear a mask, and try to stay away from people. It's really important at this time to take your HIV medications. If you have a really high viral load, if you have a low CD4 count, your immune system is not going to be working as well as it should be. So it's really important right now. Do not stop your treatments at all. You've got to be able to fight this infection. Make sure you have a 30-day supply of your medications, ideally 3 months. Right now, doctors have been instructed by Health and Human Services to make medications available at whatever cost. As some of you have probably experiences, telehealth, as far as meeting with your physicians, instead of going to the office, to do it over the phone, do it over your tablet, is much safer at this time than actually face-to-face and going into a crowded clinic. Immunizations are extremely important right now. Your flu vaccines for people over 60, pneumonia vaccines, and especially the shingles vaccines. But if you come down with a COVID-19 and you haven't had those vaccinations, put those on top of the COVID-19 and you're really hurting yourself. A really hard part too is you want to have healthy lungs. How do you have healthy lungs? If you can, stop smoking. Any type of use of inhalants should be prohibited. Vaping or anything that's really irritant to the lungs should be highly avoided. Again, if you're not feeling well, stay home. And it's really important that you eat well, you exercise, and look after your mental health. Right now, there are a lot of clinical trials on antiretrovirals to see if they can affect the COVID-19. Some of you've probably heard of Kaletra being used, and that's under clinical trials right now. Remdesivir is an antiretroviral, and it's under review for clinical trials. It's shown a lot of promise. And hydroxychloroquine is one that's also being used. But again, the recommendation is if you're living with HIV and if you're on PrEP, you should continue to take all the precautions and stay on those medications. Next slide, please. Social isolation is a problem that we're seeing that's causing some serious effects. There's a big difference between social isolation versus the social distancing. Social isolation means staying away from other people and not talking to people, and that's not what we want to do during this virus. Social distancing is what we want to do, which means keeping at least 6 feet away from each other, avoiding large crowds of people. Next slide, please. What is social isolation? It's the absence of social interactions, contacts, and relationship with family and friends, and with neighbors on an individual level, and with society at large. And that's what we're trying to do right now. But we're definitely, we're trying to social distance and not social isolate. Next slide, please. What are the effects of social isolation? What are the effects of not talking or being around people? Well, studies have shown that one's health risk can increase as much as smoking 15 cigarettes a day or misusing or abusing alcohol. Social isolation can lead to increased risk of early death. Social isolation can result in decreased immunity and an increase in inflammation. And inflammation is not what you need with this particular COVID-19 virus. Next slide, please. So what do you do to combat isolation? There's a lot of things you can do. Create a schedule and maintain a routine. Eat healthy, exercise. Even if it's just around the block. You don't need to be with anybody to do that. Wave at your neighbors as you walk or in your neighborhood on the porch. Get outdoors, get plenty of rest. Stay connected through phone or video calls. Our Ryan White Council members are calling each other just to say hello and just to check on each other, just to make sure that everybody's okay and that they're not socially isolated. This is a great time, and a lot of people are doing this around the country, is to foster or adopt an animal. It's really a comfort to have a pet in the house, a dog, a cat, whatever. Look for things that are humorous and try to stay positive. Next slide, please. If you have any questions, there are 2 great websites. One is the Harris County Public Health Department has a website that you can go to, and the Houston Health Department has websites you can go to. Now, these two sites will give you the latest information on what's going on with this virus and contact numbers to call if you want to get tested, and information about changes to the virus that I've discussed. Because what we're seeing is every week, if not every day, we're seeing things that are changing the course of this virus and how we can treat it. So that's the end of my presentation. And right now, I'd like to discuss the Quality Improvement Committee. As a co-chair, I've been very lucky to be in many of these meetings, and right now I'm going to describe how to best meet the need recommendations for 2021. The How to Best Meet the Need process has just been completed and is the focus of tonight's public hearing. Each of the Part A, Part B, and Texas Department of State Health Services funded service categories was reviewed during a series of work groups comprised of consumers, service providers, healthcare providers, and other community members. The work group made recommendations for each of the local service definitions, and the Quality Improvement Committee met to review and approve these recommendations. All comments and recommendations received from the community will be forwarded to the Quality Improvement Committee for consideration and added to the recommendations that will go to the Planning Council for final approval next month. A copy of all service definitions, as well as any recommendations from the work group and Quality Improvement Committee, is included in the information package, which is available on our website, rwbchouston.org. I'd also like to mention our use of the federal poverty guidelines as eligibility criteria for Ryan White services. These guidelines are evaluated annually during the How to Best Meet the Need process. For most services, the financial eligibility is set at 300% of the federal poverty level. The federal poverty guidelines for 2020 are as follows. For a single person, 300% of the federal poverty level is an annual income at or below $38,280. For a family of two, 300% of the poverty level is $51,720. And for a family of three, 300% of the poverty level is $65,160. For each additional family member, add $4,480. The same increment applies to smaller family sizes, as can be seen in the previous figures. According to the U.S. Department of Health and Human Services webpage, where the guidelines are located, they become effective on the day they are published. A copy of the 2020 Federal Poverty Guidelines is included in the information packet. I will now present the recommended changes to the service definitions and eligibility guidelines for fiscal year 2021. Please note that the services discussed are for people who are living with HIV and meet the required eligibility guidelines. The information packet for tonight's public hearing includes a copy of each of the service definitions that were reviewed for Part A, Part B, and state services funding, along with the summary list of the recommended changes for each service category. The current financial eligibility for each service, as well as the suggested financial eligibility for fiscal year 2021, is listed on the table of contents for the service definition packet. First, I will present the list of services for which no changes to the service definition or financial eligibility are recommended. Case management, non-medical service linkage, early intervention services targeting the incarcerated, home and community-based health services, adult day treatment, hospice services, linguistic services, oral health, untargeted and targeting the northern rural area, referral for healthcare and support services, transportation, and vision care. The Quality Improvement Committee approved the How to Best Meet the Need recommendations for the following services. Ambulatory outpatient medical care includes medical case management, local pharmacy assistance, emergency financial assistance, pharmacy assistance, outreach services, primary care re-engagement, and service linkage. Add the allowability of telehealth and telemedicine to the service definition and keep the financial eligibility the same for primary care at 300%, local pharmacy assistance program at 400% for non-HIV meds and 500% for HIV meds. Emergency financial assistance for medication at 500%, and medical case management, outreach, and service linkage with no financial eligibility. Clinical case management, add the allowability of telehealth to the service definition and keep the financial eligibility the same at no financial eligibility. Non-medical case management targeting substance use disorders, add the allowability of telehealth to the service definition and keep the financial eligibility the same at no financial eligibility. Emergency financial assistance, accept the service category definition for emergency financial assistance, other, which will provide a rapid response to personal emergencies and set the financial eligibility at 400%. The committee recommends that the subcategory begin immediately using CARES Act COVID-19 funds. After March 1, 2021, use Ryan White for state service funding. Health insurance premium and cost sharing assistance. Add text to the service definition that states that clients should receive notification when payments have been made to and received by their insurance provider and keep the financial eligibility the same at 0 to 400%. For Affordable Care Act plans must have a subsidy. Housing, refer the discussion on housing to a work group for further research. Medical nutritional therapy supplements, accept the service definition as presented and increase the financial eligibility from 300 to 400%. Mental health services, add the allowability of telehealth to the service definition, update the justification chart, and keep the financial eligibility the same at 400%. Substance use treatment, add the allowability of telehealth to the service definitions and keep the financial eligibility the same at 300%. For more information about these suggested changes, please contact the Office of Support at 832-927-7926. I will now turn the floor over to the co-chair of the Affected Community Committee, Veronica Ardoin, who will explain the process for submitting public comment regarding the information presented at tonight's public hearing. Veronica?
Thank you, Pete. And a special thanks to the Quality Improvement Committee and How to Best Meet the Need work group participants for the hard work they have put into this important process. After hearing this information presented, you may want to give public comment to the Planning Council. The Planning Council falls under the Texas Open Meetings Act, and its processes are open to the public at all levels. We strongly encourage participation by all members of the community and take public comment and input very seriously. There are several options for you to provide public comment to the Planning Council, and you are not required to give your name or HIV status. You can email your comments to feedback@hctx.net. You can fax your comments to 713-572-3740. You can call in your comments to 832-927-7926. Or you can send your comments through our Facebook page, RWPC Houston. Comments must be received by our office before 12 noon on Tuesday, June 2nd. Comments will be forwarded to the Quality Improvement Committee for review and considerations. If significant public comments related to the service categories are received, the Quality Improvement Committee will meet via Zoom at 2 p.m. on June 2nd to review the comments and consider making changes to the recommended service definitions. On June 4th and June 11th, the Steering Committee and Planning Council will review and vote on the FY 2021 service definitions. You are welcome to attend these virtual meetings. Check our website calendar for instructions on how to participate by Zoom. I now turn it over to our co-chair, Rodney Mills.
Thank you, Veronica. This concludes the first Ryan White Planning Council public hearing for 2020. I would like to thank everyone who viewed the program for participating in this important process. As stated earlier, the service category recommendations presented will not affect how services are delivered now, but will impact how services will be delivered approximately 10 months from now in the year 2021. The Ryan White Planning Council meets on the second Thursday of every month at noon. Please check the calendar on our website, rwpchouston.org, for the location of meetings as currently as they are being held on Zoom. Do not come to our office without calling to be sure we are open to visitors. Our next public hearing will be at 7 p.m. on Monday, June 30th. The topics to be presented will include priority and allocations committee's recommendations for the service category priority rankings and funding allocations for fiscal year 2021. On behalf of the Ryan White Planning Council, we thank you again for participating and have a very good evening. Thank you.